Hello, everyone, or welcome back to another session of A Day with your Fertility Specialist. I'm Joanna Damina, your host for today. Thank you so much for joining us. We really do appreciate it. Every like, every comment, every click, and every share. On that note, you might want to share this with someone you think will be interested in this topic, or somebody that you want to share this topic with. You know, you've been around and you've heard us talk about fertility, and you know that somebody might benefit from this knowledge that we share on here. You know, we're always on here to help you make more informed decisions about your fertility journey. And today we're going to be talking about modern fertility care. This is something that every couple should know, even every person should know if you plan to have that fertility journey at some point in your life. And joining us today is Dr. Ken. Hello, sir. Welcome. It's good to have you on set.
Oh yeah.
Yeah, it's been a while for you and for me as well. So this is nice. If you're joining us for the first time and you don't know who Dr. Ken is, Dr. Ken is a consultant obstetrician and gynecologist as well as an IVF specialist. So we have someone on here that is going to give us a lot of insight on this topic. Now, Dr. Ken, we're talking about modern fertility care. I mean, fertility care is something that has, also let's say fertility is something that has always been there, you know, it's something that always goes on. But when you talk about modern fertility care, is there something particular about it?
Yeah, it's actually very interesting to coin a topic like modern fertility care because you see, generations of humans, it's just rolling by.
Mm-hmm.
We've come through the is it the pre-millennial generation?
Yeah.
I don't know what generation, what they call that
Which one we're in
generation.
now?
Then we have the millennial generation
Mm-hmm.
or Generation X, pre-millennial and millennial generation, then
Gen Z,
Gen
Gen
Zs, and
Alpha,
Alphas.
yeah.
Now we are in Gen Beta,
Mm.
and then the lifestyle, you know, differs with all these generations,
Yeah.
and what you expect, the mindset, the work, the work mindset, the life demand and expectancy is
Mm-hmm.
also changing, and the demand of workforce is changing, and
Yeah.
people approach this lifestyle or these generational changes in lifestyle differently.
Mm-hmm.
And sometimes you actually don't have time to stay back and think because the world is just moving so fast,
Yeah.
and so choices are different, desires are different, the goals are different, and of
Mm-hmm.
course people don't even have time to think of how to get married,
Yeah.
and let alone getting
Getting
pregnant.
pregnant. Mm-hmm.
No, but we cannot run away from the fact that you need a population
Mm-hmm.
to run this world.
Yeah.
We've seen the population changes or the population dynamic across the world.
Mm-hmm.
How it affects GDP, gross domestic product,
Products. Yeah.
or gross domestic happiness. How it affects immigration,
Mm-hmm.
immigration, how it affects citizenship,
Yeah.
of different nations, and how it affects government policies. So we cannot but think what modern fertility care would be. And with this, we mean planning for pregnancies,
Mm-hmm.
planning for growth of population, give childbirth, and
Yeah.
all of that.
Yeah.
Then planning for the future. Should you decide not to even get married or not to get pregnant,
Mm-hmm.
and just just
And it's
just
going
all
to
of
go.
that.
Yeah.
So that's what I think the lifestyle, the modern fertility care is, and of course the care of a woman or of a couple after deliveries.
Yeah.
So for me, that's what I think the
Modern
modern
fertility is about.
lifestyle is, and of course you see with all of this um, social media lifestyle
Mm.
is ravaging the world.
Mm-hmm.
The show lifestyle, you want to look good, you want to stay good, you want to have good physique, you have to have good
Yeah.
figures and all
Yeah.
of that, and how it affects fertility.
Mm-hmm.
So those are all the things we're looking at, and I think there is no point in life where this is more relevant than
Don't
now.
know.
A
Yeah.
good example: just yesterday,
Mm-hmm.
I was with a young lady in a consulting. You know, what brought her was different.
Okay.
She just had a complaint about her breasts. But from her bio data,
Mm.
I saw that she was single,
Mm.
and then she's also not having children. But what brought her was symptoms relating to the breast.
Yeah.
But of course, I have seen a lot in life that I have to learn how to help people. And of course, open discussion. What are you thinking about fertility? She was very impressed.
Mm.
That was what brought her to the clinic.
But it was something that
But
you saw.
something she needs to look at, because
Yeah.
at 36, for instance, you're not married, you're not about getting married. You may not get married in the next 4 years.
Mm-hmm.
You know, what are we doing about your
Fertility.
fertility?
Yeah.
And you're meeting a gynecologist like me who is crazy about fertility. So we talked, and she appreciated it, because at that point, you see, she's running out of eggs already while
Yeah.
she's even still single.
Mm-hmm.
You know, no demands have been made on her eggs for any use, for storage, and all of that. So we went talking about how to preserve her fertility.
Mm-hmm.
I know she was happy that she could hear something like that, because the reality is that if she gets married the next 4 years,
It's
it's
going to
going to be very
be.
tough,
Yeah.
because she may not just get pregnant and have babies
The
as
release.
soon as she expected.
Mm-hmm.
And who knows, maybe more than 4 years later, she get married. And how the feeling will be when you get married at that age and doctor tells you have no eggs.
Yeah.
Because the egg reserve or ovarian reserve is going down drastically from the age of 35.
Sure.
You know,
Mm-hmm.
it goes down drastically from the age of 35. So these are all the things that modern fertility care will be like. And then you see quite a number of girls who have done some body augmentation surgeries, for
Yeah.
instance.
Mm-hmm.
you know maybe butt enlargement or augmentation, or having an implant in the buttocks.
Mm-hmm.
Or they want to have some fertility care. How do you go about it?
Yeah.
When do you advise them to go for fertility care, before or after? How about when you're seeing them when they've had it already? How do you
Mm-hmm.
care
How
for
do you go
them?
for that?
Because there are some injections you give intramuscularly, and
Yeah.
in Africa, for instance,
The major
the
site is
major
on the
site is the
buttocks.
buttocks.
Yeah.
And what happens to a lady when she has a butt enlargement,
Mm-hmm.
or fat transplant,
Yeah.
from some part of the body to the buttocks? What happens to it when you give an injection onto it? You may be causing an infection,
Mm-hmm.
and that may affect the transplant or the implant that she has had.
Yeah.
How do you go about that? How do they keep this information? So these are the things we may be looking at, and what the future of reproduction may be like.
Mm.
Yeah.
Okay, well, that's actually quite broad. I was
Hmm.
thinking about that. You may not look at it in that
Yeah, because you
sec.
see, these are the things that flood our own clinic these days.
Yeah.
You see a lady, that definitely she has improved her look. I like improved looks, for instance,
Mm-hmm.
because it makes you confident, it makes you look good,
Yeah.
and you feel good in yourself.
Mm-hmm.
And there's no feeling that beats the feeling of feeling good in
Feeling yourself.
yourself,
Yeah.
because it makes you like feel like you can take up the whole
On top
world.
of the world.
And then you're walking and all man's attention is on you. I think that's a good feeling when you're walking and everybody looks at you.
Yeah.
It makes you feel you're on top of the world.
Exactly.
So yeah, it's a good feeling.
Mm-hmm.
And nothing is wrong. Nothing is wrong with it. It's
Yeah.
just the way what makes you feel good.
Mm-hmm.
So they need to be cared for.
Sure.
They need to be cared for.
Yeah.
So these are the things we may have to look at. And maybe what other things you think are important to the woman
Fair enough.
and the man also
Yeah,
too.
because you're
Uh-huh.
involved in that
Uh,
too.
Apparently, men don't do so much lifts or augment
Yeah, you don't see
surgeries,
that around as
except that there
much.
are some men that I think need to do tummy talk. No, I'm serious, because you see, women think that tummy talk should be a woman's problem.
Yeah.
A man doesn't look good with the big tummy.
Mm-hmm.
Yeah, in fact, it looks uglier on a man than a woman. because we're used to the fact that women should have big tongue because they've been through a lot, giving birth, with all the stretches that happen
Yeah.
when you have a large anterior abdominal wall because of pregnancy. So we're used to that, and we're not used to men looking that way. Men can also trim, because it is healthy being trimmed. And when you have a liposuction, for instance,
Yeah.
or a tummy tuck, or some fat reduction from the thighs or from the arms, what you're doing to your body is you're reducing the metabolic load that your body has to be challenged with.
Yeah.
You reduce the load, the resistance to insulin when that is done. So it makes your insulin metabolism and control of sugar a little better.
Okay.
The load on the heart is reduced. Risks of infections are reduced. And then you are healthier, and also you are psychologically well off when you have all. So men need it too, not just women.
Yeah.
Yeah, the fact that men are not seeing the need doesn't mean they don't need it.
I
They need
mean,
it,
in our societies,
and it
most of the
helps. Wait,
time.
wait, wait.
Yeah.
Men with so much fat have poor sperms. Yeah, it's good to know that.
Okay.
Yeah, because you see the weight, especially when you have an abnormal waist to hip ratio in a man, belly fat and all of that. Reproduction is very poor. I mean, it's poorer than for a man who is trim and healthy.
Yeah.
So if you have a talk, for instance, fat reduction surgery for such kind of men, even reproduction becomes easier. The quality of sperms get better.
Yeah.
I improve. So these are modern fertility things that are not being talked about in the open platform, but these are the things we see regularly because we handle this gamut live physically. So, Roman, you want to I want to have a tummy talk. I think I'm ready to support you. You don't believe me. You don't look like you believe what I'm saying, John. You don't believe it. I'm very serious.
Okay, well,
Yeah,
if
I'm
you're a
serious.
man out there, you want to have a tummy talk, you have a number one supporter on here.
No, but that's the truth. That's the truth.
No, yeah, no, that's true. Yeah, it actually does make a lot of sense, because over time we've spoken about how weight affects, your fertility prospects and, all the reproductive issues that come with it. So, of course, it's not going to be on one side alone. So, I mean, I know that it sounds very strange, especially in society. I mean, growing up, I know that a couple times you hear, oh, somebody that has a big stomach is living large. They are enjoying,
But
this person
this
is
generation
chilling.
of this social media generation has enlightened us so much to know
That's
that
not true.
having 6, 8, 10 packs is the
Yeah.
way that men should go.
Yeah.
Because there's just no glory in having this one pack abdomen.
It's a big pack as well.
It's just not glory. It needs to be trimmed. It needs to be trimmed.
Yeah.
If you don't trim it by exercise, you trim it by surgery. Whatever kind of surgery.
Yeah.
You can trim it with the surgery and dieting, lifestyle
Very,
modification.
very important as well.
Mhm.
So for you, I know you've been in this sector for a very long time. I mean, if you've gone to, learn a little bit more about our guest on here, you know that Dr. Ken has been in the fertility sector for a lot of years. Have you noticed any shifts or any changes in the perception of fertility and infertility in our generation as well?
Yes, the shift we're having in fertility is that in this generation now the age of first conception has moved higher.
Wow.
Yeah. Just early this year in Frankfurt, where we have a big European meeting about reproduction. The observation was that in the European society, the age of first pregnancy is between 36 to 38. I know my mom gave birth to me when she was around 20.
Wow. Yeah.
And at that point, that's when you have quality kids. Because the eggs are better. The younger men also have better sperms. Risks of having abnormalities with the babies, miscarriages, and all of that is well reduced.
Yeah.
So now age of first pregnancy is about 36 to 38, and it's not just in the Western world. It's even in Nigeria. If you look at the average age at which women get married, for instance, it's increased. But there are a lot of good for that. Women's sperm to go to school, social and and the women empowerment and all of that. But these are at the expense of fertility potentials. So the average age of first conception or first delivery is high, and that affects the population negatively. So then and then not many not a big fraction of the population even get pregnant at that stage. A good number of them go beyond there before they get pregnant.
Yeah.
And then the demand on quality of eggs is increasing, but then it's not even available that much. So that's a shift we're seeing now. you know and then it's affecting population, and that is why population of most of the European countries is dwindling. Japan, for instance, the fertility rate is very low. England, very low. Belgium, very low. Spain, very low. The only areas where you have high fertility rate are the third world countries. And if at all there is a second world country, the Asian countries,
Yeah.
you have high fertility rates. Yeah, because the gender social revolution is not as high as it is in sub-Saharan Africa and in the Asian countries. Yeah, so that's where we have the shift. And of course, you see, with the lifestyle too, we're having another shift. You have a high incidence now of same-sex marriages.
Yeah.
When you are in a same-sex marriage, I mean, your perspective for fertility care is kind of different.
Exactly.
You need special care, for you to be able to achieve pregnancy. And care, usually care of assisted reproduction technology.
Yes.
And all the varieties of assisted reproduction technology. And and then the challenge will now be when somebody becomes trans and decide to detrans, if there's a word like that, to untrans.
I actually don't know what the word is.
There
but
are,
yeah, I know that they
you
use
have
that.
people who were trans,
Yeah, and then
and then
reverse
decide
back
to
to your-
reverse.
yeah.
Maybe a lady, become a trans, and then she spent her youthful period in that
As
trans
in,
world,
yeah.
and now realize that that's probably not the right way to go, and then want to go back, and then she would have spent her ovarian age.
Yeah.
I mean, living a different kind of life, and then she's back. So even when they decide to be trans, my thought will have been, have a bank of your eggs.
Yeah.
Because you may just have a change of mind, because these things come with some negative effect sometimes. More so when you're not too sure of what you really want, and you just go with the flow,
Yeah.
and then you're coming back for a change.
I mean, even if you do want to be, you want to end up trans, or changing your sex, however, or how you feel you're changing your sex, and then you get that your ovarian reserve, like we've spoken about fertility preservation, either freezing it or getting into the stage of embryos and then freezing the embryos. Even if you remain a trans male, at least maybe you think about having a partner in future, you can still have babies from your own oocytes when you
Exactly.
get to that
Exactly.
stage. Yeah,
So you see, these are fertility cares.
Yeah.
And we just need to talk about this. The fact that people even become trans or no trans, or same-sex marriage and all of that, doesn't mean that they should be excluded from fertility care.
Yeah.
It's our obligation to still care for them. And then depending on the society where you are, it may be constitutional to give them the standard care that
Yeah,
they need,
exactly.
and then you just have to give it to them, because you have to look beyond the social stratum that you think you're operating. Because whatever gender or whatever sexual orientation you have, there is an index that controls the world. Is a population. If you do anything to prevent the population from growing, you're going to hurt the world economy, and then that may just not be good. So whatever it is, then there's needs for procreation. And the way I see it occasionally is this: we even get into a future where you could make a sperm and an egg all from one person.
Yeah.
So what do you talk about reproduction? See, I constantly tell my guests or my followers that reproduction hasn't yet started.
Yeah. Sounds interesting.
We're just in the primitive phase of reproduction, in the tier 1 level of reproduction. And the world hasn't yet even come to terms with it.
Yeah.
How about when we get to a point that I say I don't need a wife, for instance? I want to have kids all by myself. You get sperm from me, you get egg from me, and then you make babies for me. So what would the world say?
It's
Because you
crazy.
see, if you stop that from happening, you're going to kill the population.
Mm.
Yeah, even though not all member of the populations will have need for that. Some people are still going to be traditional
Yes, of course.
and cultural,
There will
which is
always
good.
be people.
So the world is balanced.
Mhm.
But this fraction of the population may need some care. Maybe we're going too deep for our viewers or for the listeners,
No, but I
but
think,
this is modern fertility
yeah.
care. Modern fertility care. Ladies have to be told how to preserve their garments while they are unsure of the lifestyle they are adopting or of the stage of life they're in.
Yeah.
Even guys have to be told how to preserve their garments. Yeah, more importantly, how to have kids when you're young,
Mm-hmm.
except, of course,
Yeah.
that's not a necessity.
For them. But
Mhm.
I mean, most of the time, anyways, even if you don't want to have kids when you're young, at some point, I feel like it just comes in like naturally. There's that instinct to procreate. You just think about it. Although, yes, there are definitely people that would
Mm.
rather not even for the rest of their lives
Mm.
and just be the cool uncle or cool aunt. But
Yeah.
it still comes up and it's still
Hmm.
something important. And you said we will be going too deep for our viewers, but I think it's still an important thing to talk about. It might be the first time they're hearing about this
Mm.
direction of fertility care, and you might say we're ahead of our time, but if fertility is going to keep moving ahead the way
Hmm.
we
Hmm.
predict, then definitely we're going to need to catch up to that. So I think the earlier the better.
Oh yeah,
Yeah.
talking about how people get uterine transplant when they don't even have womb,
Mm-hmm.
and have a transplant of the womb and
Yeah.
have babies, then
You,
decide what to do with your womb. So you see, options are just expanding and
mm-hmm.
increasing. And so we're getting to a point where fertility care is going to be
Yeah.
individualized based on your religion, your culture, your social status,
Mm-hmm.
your gender orientation, and all of that. But more important for our generation for now is individualized fertility care.
Yeah.
Fertility care that is just based on me,
You as a
Ken,
person.
or based on you,
Mm-hmm.
based on your status in life, your age, your religion, and all of that.
Yeah.
And I think everybody should be thinking about that. And so we don't get to a point where you just live your life as if nothing is important. No, you need this population.
Mm-hmm.
You need a population, yeah, you need a safe place for the population as well. So it
Yeah.
should be individualized,
Yeah.
individualized, yeah,
Individualized
and
care.
not what goes for you or what's good for you that may be good for me.
Another
Just as
person.
women always compare notes, and why
Mm.
they can do this for this
I was
lady,
going to say, like,
and
how
he should do
important
this for this lady.
would you say it is to how would I say, take off that mindset of comparison,
Oh yeah,
comparing your
women do
fertility
that.
journey to
Women do
another
that a lot.
person.
Women do that a lot. For instance, in an IVF treatment cycle, like a cohort of women starts the IVF treatment cycle,
Mm-hmm.
and I get to your case, I say, oh no, we're going to freeze all your eggs because we don't like how the progression is.
Yeah.
Some women just start crying.
Mm.
Why is Ken going to freeze all these eggs? I mean, why these other ones have fertilization
Yeah.
and I'm going to have embryo transfer? No, you're all different. The kind of receptors your ovaries have or your follicles have are all different.
Different.
The way they respond to medication is different. The amount of reserve you have in the ovary is different. So the advice for you may just not be the same advice. So when you get to a point where you have the same advice, everybody needs the doctor doesn't know what he's doing,
Yeah.
man. We can't all have, our heights are different, our ovarian reserves are different, our age is different, the kind of uterus we have are all not similar because they've been through different things in life.
Mm-hmm.
Some uterus are young, some uterus are old, and of course, it's good to mention the older uterus don't get pregnant as quick as
So,
the young uterus.
yeah.
It's established fact.
Mm.
So individualized care should be what we are looking at. And so the gynecologists or the reproductive medicine specialists will put all your bio, I think that's the word they use in social media now,
Yeah.
right?
Yeah. Your
Bio,
biology, yeah.
your bio
Mm-hmm.
in perspective when making decisions for
Yeah.
you. And they see you and say, oh, you need to start IVF today.
Mm-hmm.
And you still have 2 years to play around.
Yeah.
It all depends on the findings.
Mm-hmm.
So it needs to be individualized at every point in time. And it's based on your history, expectations, culture, religion. Like what I may do for a Christian couple, for instance, or what I would advise a Christian couple may be different from what I would advise a Muslim couple.
Yeah.
So it's also good to know what these religions religion expects. And of course, what is religion expects sometimes out of science. It's just out of ignorance. We've seen a lot of ignorance coming from the Islamic sect, a lot of ignorance coming from the Christian sect,
Yeah.
all because of a fanatical ideology, which is contrary to human nature.
Yeah.
And we cannot allow science to be taken by just your religious ideology. Science respects human nature. I will make our decision in science based on human nature. In respect to human nature. Yeah, if your religion doesn't agree with that, we'll leave it to your religion. We'll give you what your religion wants. So you are at peace with your religion and with yourself. Yeah. Individualized care, that's what we mean.
That's interesting.
So this is where modern fertility care comes into play.
And I know, like you said, there's a lot of comparison that goes on between the women that you you treat. But I think also there's this online thing, right? You can, maybe they don't compare with people that they see in person. It may even just be somebody's story they read online or some piece of information that comes about online, and then you say, oh, this is what helps my fertility journey. If your doctor is not doing this, ask that. And so how do you get your clients to, differentiate between some of this misinformation or a different kind of information as to what is actually evidence-based and the science that you actually practice?
Yeah. You see, we as doctors, we get this comparison all the time, But then, what you need to do is all the decisions are taken from all kinds of findings, the history, laboratory findings, or even some advanced investigation findings, and then the findings may be different for different persons. When women go online, for instance, and say this is what my doctor did, usually the information they give may just not be composite enough, to cover for every gap that the world needs to know. And then every woman takes the information and absorb the information totally and make demands on her doctor. Why am I not going this way? It can't be that way because genetically you all not the same. The eggs you have are not similar. Your ages may not, even when your ages are the same, the ovarian reserve may just not be the same. And the advice from the doctor may just not be the same. This is not to say that one advice cannot work for 2 or 3 people, but it can't work for so many people. So as a doctor, you need to know all of that and find explanation for all of this because it's just common in our world today. Oh, why did she have cesarean section? Why am I not having cesarean section? Or why did she have vaginal delivery? I must have vaginal delivery. These are all based on indices. You both start labor at the same time, for instance, or went into labor at the same time, and she's making adequate progress, and you are not making adequate progress. Of course, you see there are already differences. The sizes of the babies may not be the same. Even the configuration of the pelvis may not be the same. And so, how do you expect the same outcome? So just take the outcome based on expert opinion. And of course, you see, even when we give expert opinion sometimes, it doesn't mean it must be the way we want it. Yes, when we give expert opinion, for instance, we say it's advisable for you to have a cesarean delivery. It doesn't mean that when you are stubborn and go your own way, you may not have a safe delivery. It's just that a larger proportion of people that decide to go your way after being advised may go into crisis. Yes, it doesn't mean you can't succeed. It's just an advice and assessment to avert danger.
Yeah, you see that sometimes, you say, oh, this doctor said I should do this and I didn't do it and I was fine. And then somebody takes that information and they just don't listen to what it is.
Sometimes it happens in church a lot. They say the doctor said I can't deliver by myself. And I refused because I have to deliver for myself, my man. And then, it just worked. No, it's not a miracle. You understand? You're just lucky to be among those who escape that statistics. Yes. The fact that the doctor says you can't have this your way or you shouldn't have it this way doesn't mean you will not succeed when you go that way. It's just that you're taking so much risk. And that risk may not be worth it. For instance, I have seen a woman before, and a doctor in facility where I work called me to review the baby, and the baby was very massive, very tall woman. She's just like a giant, and the baby was big. From
Yeah.
clinical assessment, ultrasound assessment, it showed that the baby was getting towards 5 kg. 5 kilogram. 5 kilogram should be about 10 pounds plus.
Yeah.
For some weird reason, say she must deliver by herself. I was like, no, I'm scared. I can't permit that to happen. This is just one case that I will not say you should be allowed and be monitored. It's not just permissible in this facility because I'll be responsible. She left and she wanted to go somewhere where you have people without clinical acumen, and she was permitted. What talking about her? We followed her there. To find out what happened. She tore her pelvis. Yes, because she was allowed. Yeah, she tore and she lost the baby. So she was stubborn, kind of. Those all the things that happen. So it's not all those stubborn decisions that go well. Some will go well, and even when they go well, it doesn't mean the doctor has lied to you. It does that he wanted you to avoid that risk and go the safer route. So these are personalized care. You can't have it this way because everybody has had it that way. So this is where modern fertility care comes in. You have to individualize the clients and give them what you think is befitting to them.
Okay. We have comments or questions, I'll say, from Facebook. Thank you very much for interacting and thank you for joining us today. First, we have Noji Shaya. Thank you. She says, for a woman that has undergone body enhancement, is it really safe to undergo fertility treatment? And if she eventually gives birth, will she be able to breastfeed?
Now it depends on what body enhancement you're talking about. Is it breast enhancement, breast augmentation, or breast reduction, or butt lift and all of that? Whatever kind of body enhancement you do, you can actually conceive, you can give birth, and you can breastfeed. But it's good to know that you may lose the physique after delivery, and that is why sometimes it's advisable to allow you to have all your deliveries before you do the body enhancement. Otherwise, you may need to revisit it again. And if you have to revisit it, why not visit it again and get your spark? So that's just it. Because you see, when a woman gets pregnant, her breast gets enlarged, and for some women, the breast doesn't go back to the size it ever was. The buttocks may change, and it may not get back to the size it was. Even the size of the feet may change.
That's true.
The size of the digits, fingers may change, and you find them changing the rings and all of that. So if you had body enhancement, you may need to reconsider with your specialist before doing that. Otherwise, there are other options of getting pregnant.
Sorry, guessing.
Exactly.
So we have Victoria Kalu on Facebook. This is about her period. It says it started on 29th June. Today is 17th of July, and this morning it started again. Please, is it normal? I don't know.
Oh, well, this doesn't sound normal because it's 2 weeks. 29, this is 16, 17, just about 2 weeks,
2 weeks plus
some days. So when you have those kind of stuff, there's an abnormality definitely going on somewhere. Now we can't tell what it is because we've not examined her, we've not seen her, we don't know what's going on. One or two things will be going on. She may be having a polycystic ovary. She may be having a growth in the uterine cavity, maybe fibroid, polyp, and then we don't know her age. She may be at that age, advanced age, where menses is becoming so irregular, when you are perimenopausal and menses are not behaving like obeying any timing. They may decide to be a little earlier and they may decide to be a little later. So we need to know what the bio is.
That bio is super important.
And of course, and with investigation, you should be able to know what's causing that, and of course, you give her some help. Because if she's a young woman and this is happening, it will affect reproduction definitely.
Okay. Well, just to kind of wrap it up, we've spoken about how there's been a lot of changes in fertility and when people start to consider fertility, right? But for people that actually end up doing that, let's say they've gotten to a point in their professional life and their personal life, social life, whatever it is, what is something that you wish that they would know before walking into a fertility clinic?
Sorry, I don't think I understand the question properly.
Okay, so
Do you
if
want to take it again?
someone who wants to begin or have a better idea of their
Mm.
fertility journey.
Yeah, yeah.
Let's say you've worked and you've reached the point where you want, especially like so our career focused women
Oh
and
yeah.
things like that. There's things that they might need to know when they go into fertility. I mean,
Mm.
sometimes need to know beforehand, but
Mm.
let's say they didn't know that
Mm.
beforehand, and then they come into a fertility clinic for the first time, and they're just like mind blown, confused. How would you guide them?
So usually what I will advise in this situation is that if a woman is having a delay, whether she's schooling, she's in the politics or a big administrative staff in the company also, she can always check up with the gynecologist to find out what her fertility status is.
Yeah.
That's how to start. So you don't get to that point where everything is late. You don't get to that point where everything is late because we've seen that currently the rate at which ladies freeze their eggs are becoming very frequent.
Yeah.
Yes.
Wow. Okay.
Yeah, and painfully for some, they come very late.
Mm.
So they need to come early to do that and forget about that.
Yeah.
And then take their life until they get pregnant. I mean, until they're ready to use to become pregnant, and then the eggs can be used for whatever it is that is needful at that point in time.
Okay.
So, but for those who come advanced, what they need to know is that the doctor first of all want to see what the fertility potential is,
Yeah.
seeing the capacity of the ovaries, and of course look at the uterus itself, because when you stay very advanced before coming, at that point you may also have some growth in the uterus,
Oh, wow.
or in the cavity of the
So
uterus.
basically, just as young, beg.
You understand? So you may be having some fibroids or polyps or something, and then the doctor may want to address that before as part of your fertility care. I've seen quite a number of women who have fibroids, and I've told them, yeah, even though you just got married, and please get rid of this fibroid before you think of pregnancy, because fibroid and pregnancy can be very catastrophic. The discomfort, you could actually get pregnant with fibroid, deliver, and all of that. But the stories around it are usually not very palatable before the delivery happens. And it's always nice to take care of things and not to walk into complications.
Yeah.
So you advise them appropriately.
Okay.
Yeah.
So basically, you just want to have your doctor or your fertility specialist actually look at you as a person and get to know all your information before making any decisions. You're not just doing that based off of what you saw or what you've heard somewhere. Yes, it could be what will prompt you to want to come and look into your own thing, but at least your own personal data needs to be the forefront of the decisions that you're making. And then there's also something quite important when it comes to lifestyles. You spoke about lifestyle a little bit earlier. Lifestyle changes are quite common these days as opposed to what we used to have previously. You have people working more, you have people sleeping less, you have people eating less healthy, you have people maybe not working out or exercising as much. How do all these things affect fertility as well? Because this is something that we see in this day and age.
Yeah, less sleep affects fertility negatively. Poor diet affects reproductive organs and fertility negatively, because we have a lot of scientific findings that people who eat food in the near natural form
Yeah.
without being unduly processed have better fertility potential than
Okay.
those who consume the overtly processed food. So yes, all of these affect them. All affect the drinking, the smoking. They all affect fertility. And of course, premorbid conditions, infections like the HIVs,
Yeah.
they all affect fertility. Yeah, they affect fertility. The rate of fertility is affected by those. And of course, the medications that people are on could affect negatively.
And there's also a
You
lot of
know,
self-medication
you know,
lately.
like for instance, in our clinics, men, we get men involved a lot in our clinics because the days that you think that men are innocent, uh, were those days of ignorance.
Yeah.
A man on antihypertensive medication may be finding it a little difficult making his wife pregnant as quickly as he thought, because some of the antihypertensive medications, for instance, antagonize healthy development of sperms.
Yeah.
Sometimes you have to understand that lifestyle and change the medications, the healthy medications, for pregnancy to happen by any means, whether by IVF or by spontaneous conception. You know, so you need to just understand life in a little more advanced way. to make fertility work and journey
Mhm.
easy for a lot of people. That's just what it takes. That's just what it takes. So when you talk fertility, it's a whole world.
Yeah,
Just a whole world,
pretty
man.
big.
It's quite big.
Yeah.
There's no end talking about it.
Well, if you leave Dr. K, there's really no end talking about it. But of course, all those things have to come to an end. Um, so basically, today, we had Dr. Ken, talking about a little bit more in the modern fertility aspect that you might not have thought about. And if this was important and if this was insightful to you, would really love if you would let us know and ask your questions. Um, to round us up, we have a couple questions from our viewers on Facebook. First, we have Inkechi Esther. She says, Dr. Ken, good afternoon, sir. Please, sir, how can one control high blood pressure in pregnancy?
Interesting.
Mm-hmm.
Well, you need to be under the care of an obstetrician, gynecologist.
Yeah,
The cause of the hypertension in pregnancy will be determined. More often, it's pregnancy-induced hypertension or chronic hypertension that predates
pregnancy.
pregnancy.
Yeah.
The right medications will be given, the right lifestyle will be advised, and the timing to deliver the baby will be made, because sometimes these babies may need to be delivered early to
Mm,
prevent undue complications to the baby and over
to
onto
the
the mother.
mother.
So you
Yeah.
need a personalized care in
Mm-hmm.
this case. So
Yeah.
it's not what one would just answer just on the
Just like
media. You
that.
need to be under the care of an obstetrician. Yeah, of an obstetrician, or usually
Okay.
the fetal maternal specialists,
Yeah.
obstetricians. Yeah.
Then we have one from Alade Faith Opeyemi on Facebook. She says we have a lot of infertility issues in Nigeria, and checking on fertility is quite expensive, and most people might not be able to afford it. How do you see that?
It's not expensive in Nigeria. It is the
Mm.
cheapest in Nigeria.
Wow.
Yeah, maybe when you look at the economic situation of Nigeria, you think it is a little more
More
expensive.
expensive.
I had some clients from France, who came with their investigation result from France.
Mm-hmm.
You needed to have some surgeries in Nigeria, and I needed to operate them. The cost of MRI they did in equivalent in Nigeria was 1 point something million naira equivalent in
Wow.
Nigeria. This is in pursuit for fertility. They needed fertility care and wanted to have surgeries before the fertility care.
Mm-hmm.
Just MRI
Mm-hmm.
cost 1 point something million, 1.2 million
Wow.
equivalent. MRI in Nigeria, in
It's,
Jaws, for instance, is
it's something
75,000
thousand.
naira or
It's not even up to a
80,000.
hundred
It's not even up to
thousand.
100,000. So when you say it is expensive in Nigeria, what exactly do you mean?
Mm.
I don't know how to answer that question, because Nigeria actually charges the least, even among East African and Central African countries in healthcare.
Yeah.
We've done all of that comparison and we've
Mm.
seen. So it is not expensive. It's just not expensive at
So
all.
look into
It's
it.
relative. It's not
Yeah.
expensive.
You might maybe want to do a little bit more research on other fertility
In fact,
clinics
the same
also.
reason why a lot of guys from the United Kingdom cannot afford surgeries in the United Kingdom, they have to come over to Nigeria
Yeah.
to have surgeries in Nigeria.
Wow.
The IVF we talk about in Nigeria. IVF is just about 2 million. 2 million is not how much is 2 million equivalent
In
in
pounds? I
dollars?
don't think it's
In dollars,
like
it shouldn't be up to
it shouldn't be
a
up to
thousand
yeah, it
dollars.
shouldn't be up to
It shouldn't be up to
even if
maybe
it's up to
maybe a
maybe
thousand
not
five,
yeah, it
a
shouldn't be up to
thousand
two
five
thousand
dollars.
though. No.
$1,005. But
Yeah.
IVF in the United States is up to $15,000.
Mm-hmm.
In the UK, for instance, talking between £8,000 to £10,000.
Wow.
So how expensive is it? So you see, our economy is poor on this side. So that
Exactly.
on that on in that regard, you may think it's expensive,
Mm.
but it's not necessarily expensive. It's just that the system is not working.
Yeah.
The government could provide a system to cover a lot of cost for these guys, just the way the United Kingdom government does,
Mm-hmm.
even though the waiting list
It's
is
long.
is up to eternity in some
Yeah.
of those countries.
Yeah. Okay.
System differences.
So one last question before we go. We have another question from Alade Faith on Facebook. She asked, patients with tubal blockages, apart from or aside IVF, what is another way of conception?
Yeah, interesting. Before now,
Mm-hmm.
tuber surgeries were considered to be obsolete.
Mm-hmm.
I'm talking while I was a resident.
Okay.
Tubal surgeries were like frowned at.
Mm-hmm.
That was because they were done openly, as in open crude surgery,
Yeah.
and IVF was the way to go. But now we're back into the era of having tubal surgeries.
Okay.
If the blockage is the type that is amenable to tubal surgery, because we have this kind of, are we getting beyond our time?
A little
Maybe.
bit, yeah.
We have
but
we
but
we
our viewers have been
I've
very
asked
interactive.
questions, of course. We have some kind of family planning modalities where you cut off the tubes.
Mm-hmm.
And usually when you cut off the tube, it's just IVF
Yeah.
you have to do.
Yeah.
I just returned from an international conference
Mm-hmm.
where these tubal surgeries are back in vogue again.
Oh wow.
Yeah, but the modalities of doing them now is quite advanced.
Mm-hmm.
The material used for such surgeries are quite advanced. Laparoscopically with the kind of threads or suture material
Okay.
that you barely can see with your eyes.
Mm.
All of this is to prevent scarring, adhesions,
Mm-hmm.
and then tubes that were once cut off can now be reconnected, and so a woman can still conceive with her tubes.
Okay.
Because we have women. The world is quite modern. A woman can walk into your consulting room and say, "Hey, Ken, this is what I want.
Mm-hmm.
This is what I demand."
Mm-hmm.
Those days, our mothers don't have the right to say this in the clinic.
Yeah.
If you say that your doctor walks you out of the clinic,
Mm-hmm.
but if you say that your modern doctor, he thinks, how do we work this out?
Exactly.
All we need to do now is to negotiate. Yes, madam, this can be done, but these are the chances you have.
Yeah.
These are the risks. If you're ready, you sign your risks, you take your chances, and we go. So tubal surgeries can be done today. In fact, I am leading in Nigeria this year. There's going to be what we call the conference of gynecological minimal access surgeon.
Okay.
I am the chairman of when you say chairman, I think it has to be a very big person, right? Yes, I am the chairman of the scientific committee. And one of the topics we're taking is tubal surgery, just when IVF is not accepted by a woman.
Okay.
Still give her another option.
Yeah.
And then we're going to have one of the experts in tubal surgeries in the world I think it's from Morocco. Yeah, that'll be doing that. So what was obsolete before, because of the technique, is now being refined and is resurfacing again in the field of reproductive medicine, reproductive surgeries.
Yeah.
So this question, yes, tubal surgery can still be done, but then we have to battle with the cost. Now, IVF is a straightforward way to go about it. You also battle with the cost. Some people don't like IVF for several reasons.
Yeah.
So tubal surgery may just be the way to go.
Okay.
Yeah, when you see the surgery, it's very beautiful surgery.
Yeah, we'll go into
Very beautiful surgery. Yeah, so it's modern fertility care.
Yeah. Well, thank you so much, everyone, for sticking with us.
A woman can
Every
just walk
time.
into the consulting room and say, "Oh, Ken,
Mhm.
take my eggs,
Mhm.
freeze them. I'll be back whenever I come."
Yeah.
That's the way it's going. It means she has rationalized it.
Mhm.
She has ended so many relationships for some reasons best known to her, and she knows time is not on her side,
Yeah.
and the eggs are going fast.
Mhm.
She wants to just save the eggs and decide what to do with them later.
Yeah.
And as Ruth will always say, save your eggs, cryopreserve your eggs, and thank us later.
Thank us later. Yeah, she does say
I know
that.
for the men, when you're young, freeze your sperms
Mhm.
and thank
And
us
thank us
later.
later.
And for the men that are overtly obese,
Pure
please,
tummy
let's
talk.
talk about tummy talk.
If you're joining us at this point, Dr. Ken says, as a man, if you want to do a tummy talk, he will support you.
I will support. Yeah, I will
So,
support.
yeah, thank you so much, everyone, for joining us. And we've gone a little bit over time, but it's always very interesting. If you have Dr. Ken on set, you just know that it's about to be a lot of discussions and the things that we've touched on that you may not have known about. So, if you have any more questions, please don't hesitate to put
On a
those in
final note, sometimes because
comments.
men will need to do tummy talk because to improve healthy sperms.
Mhm.
Sometimes in the IVF laboratory, we see a lot of bad sperms, and we just talk to ourselves, the boys, the guys, guys. Bless, we need to go check our sperms because we get scared.
Yeah, because you're seeing something you're like,
So many bad sperms. How does this look like? I'm also now that scientists have have propounded that it's very likely that men are going to be extinct because sperms are deteriorating very
Yeah,
quickly.
yeah.
So we are now becoming endangered species. So
Mhm.
we need to do every lifestyle to preserve our
I think we had that
sperms.
discussion with Mr. Steve, our
You
biologist.
can see
Yes,
what
so
I'm
we were
talking
talking
about.
about that. So
Uh-huh.
yeah, we've had a couple of discussions on this as well as tuber blockage. We spoke about hydrosalpinx a couple months back. I know,
Yes, yeah,
yeah.
yeah, yeah.
So
Surgeries for hydrosalpinx, it's also
exactly.
coming up now.
So
Yeah,
we
yeah.
can always go back and watch all of these videos. We have a lot of information, a lot of backlog on our YouTube and Facebook, especially. You can go and watch all of these. And if you have comments, please put them in our comment sections. Maybe the next session that we have, we may be able to answer those questions, or even online, we answer your questions back, and you can feel free to DM us about any more inquiries that you have. So yes, again, finally, thank
I
you.
no, no, no. I like reproductive adventure,
Yeah.
and I hope that people around me can tolerate me.
No, I think they do because it's actually interesting. So yes, I'm going to just say bye at this point because if I do my whole spiel, he will interrupt me again. Bye everyone. Have a lovely
My
evening.
dear Lord. Thank you.